Okay, everybody, I'm back again. This is Dr. Ann Auburn from the Natural Health Improvement Center in West Michigan, and this time I'm going to be talking about how to do rectal ozone. I'm going to show you how to fill the bags and describe how it's done. It's extremely simple. When I say the word rectal ozone, people kind of cringe and think, oh geez, is that like an enema or something? And it's really simpler than that. It's not hard to do at all. The treatment itself takes literally 30 seconds. And just that fast, the ozone is combining with those membranes that that are on the outside of the mucous membranes, the cells that line your rectum. And it goes immediately in there, immediately has the lipid peroxidase reaction that then starts a chain reaction of things that cause the body to increase blood flow, circulation, improve oxygenation of your tissues. That actually makes your body pick up more oxygen at the cellular level. It helps your body to make antioxidants, to make antibodies. There have been many, many antibodies that have been measured to go up with ozone. With rectal ozone, there was actually a study in the 1930s that I talk about in my lectures, that the guy was doing rectal ozone and he was measuring a component in the blood called oxyhemoglobin, and he had his patients do 30 days of daily rectal ozone, and that number went way, way up. And then funny thing is after they were done with the rectal ozone treatments, he kept measuring the oxyhemoglobin level, and it stayed high for weeks to months depending on the person. So many of these treatments that we do with ozone, it's yes, only going to do a certain amount at that time, and yes, you need them more intensively and more often when you're dealing with something more acute, like say shingles or something like that. If you had shingles, I would definitely recommend that you go to a clinic like mine that does functional medicine, where you can get the intravenous form of IV ozone, and that's going to be the most powerful. But if all you had at your disposal was rectal ozone, you'd have a pretty good shot of knocking that virus down, making it become dormant, reducing your possibility of having post-herpetic neuralgia. We've done this many times at the clinic using the IV ozone, but you can do the rectal ozone at home, and there's been studies in Cuba. Cuba used to have an ozone hospital, and that's because they don't have that much money, and they were studying it, and they were looking at it from the ophthalmologist's point of view, and they were using it for glaucoma, retinitis pigmentosa, and macular degeneration, and they saw very positive improvements in the majority of patients doing it. They were doing it 5 days a week for a month, and then they took a month break, and then they did another 5 days a week for a month, and they measured all these various neurological components of eye function and general eyesight and eye pressures for the glaucoma patients, and the majority of the people had improvement. And those are all eye diseases that there really isn't any cure. There's things that can be done, medicines and whatnot, which, if your disease was severe enough, you'd want to also do those things too, but why not add rectal ozone in there and slow down the progression of that disease, or stop it if possible. Anyway, it's a very easy thing to do at home, plus you're building antibodies, you're improving your immune function. You're making your body more resilient, you're doing anti-aging. So the way you do this is, we've got a bag, and this is going to be filled to, when you start out, you're only going to want to do about 100 cc's. You have to get your rectum kind of used to the body receiving this gas. And so you start out the first week, you would do 100 cc's, 2 or 3 days a week. If you want, you can do it every day. And then after a week or two, you would go up to 200 cc's, and then another week or two, 300 cc's. And then basically the dose that I have people do once they're all the way up to it is 400 cc's. And when I make the rectal ozone, I usually do the 1/8 liter per minute. The instructions are in this booklet from Simply O3 as well. So you'll get full instructions on what to set your ozone generator at and whatnot. So I'm going to hook this up to my ozone generator. Okay, I'm going to put my oxygen tank flow at 1/4 liter per minute. And that oxygen is flowing in now, but now we want to, actually I'm going to detach this because you want to get the ozone flowing first before you start filling the bag. So you're going to turn it on, let it run for about 5 or 10 seconds just so you know there's ozone. And then you're going to screw the line into the ozone generator, and then you will see that it will slowly fill up with ozone gas. I usually just lay it on the table and let it do its thing. And as it's filling, I'm just going to watch that bag. I'm going to kind of fold it over to the 400 cc mark. There's a line for 200 cc's and a line for 400 cc's. So when I do it, I basically do 400 cc's every time. Now some of the particulars, you want to do this after you've had a good bowel movement. You don't want to have stool sitting in the lower colon rectum area because you are going to insert the catheter up about 4 inches. Okay, and then it looks like our ozone is right about the 400 mark, maybe a little bit more to go. You can see the bag is getting a little bit fatter there. Okay, I can feel the ozone in there. So yeah, usually morning is a good time. Most people will have a bowel movement in the morning and have some clearing there. If there's a little bit of stool that ends up on the end of the catheter, that's okay. We just don't want it just going directly into stool because then you're not going to get the ozone hitting the mucous membranes and getting into your body. So now we can turn our ozone generator off. And I'm just going to pinch my line off. Normally it comes with a little clip and mine broke, so I'm just going to pinch it off so it stays in there. I'm going to turn off my oxygen tank. I'm going to unscrew the bag from the generator, and then I'm going to screw on the catheter. And then, of course, I'm not going to show you how to do this, but I'll just kind of demonstrate. You're going to want something that's a little bit greasy on the end, so I usually keep just a little jar of olive oil in my bathroom where I do this, and I just put a little olive oil on the end of the catheter there. And then basically I just kind of put my fingers about 3 or 4 inches down on the catheter, and then I do this standing because standing is the easiest way for me. You could do it sitting, on the toilet or sitting anywhere you want, but I usually just stand. That's the easiest. And then I can feel my fingers kind of touch the buttocks, so then I know, okay, it's in far enough. And then I just kind of pinch my cheeks together to hold it in there, so that will be inside the body. This is going to be laying on my counter, and then I'm just going to take the bag and I'm just going to roll it in like that. And then I can smell the ozone because it's not in anything. And that ozone is going to go directly into the colon area, and then I just hold my cheeks together for 30 seconds because I want to hold that in there and let that ozone do its magic, which what it does is it combines with the lipid membranes of the cells that line the colon, and then immediately that reaction starts taking place. It's done. Now, because ozone, when you make it, actually it's only 3% ozone and the rest is oxygen. So 97% of it is still oxygen. Amazingly though, just that 3% ozone in the mixture that you make is going to do some amazing things. But so when you're done, you might feel like there's still a little air in there. It does not mean that the ozone is lost because you're going to pass a little bit of gas. The ozone's already gone. It's already done its thing. So usually when I do this in the bathroom, I'll just sit down on the toilet. I'll let that little bit of gas come out. Occasionally I've had a little bit of mucus or something come out, not usually, but I just sit on the toilet and then basically you're done. And then what's left to do actually takes longer than the treatment, and that is just cleaning up this. I have these 30 cc syringes or 60 cc syringes. I just fill them with a combination of about 25%, 3% hydrogen peroxide like this, and the rest of it's water. And I just have a cup there, and I drop the water, and then I take the little catheter off there, and I just shoot that hydrogen peroxide and water through that down the sink. Okay, and I do that about 3 or 4 times, and then I can see that it's pretty much clean, and then I just kind of clean out my bathroom sink. I put about a half a cup of hydrogen peroxide, maybe even just a quarter cup, and then I fill the sink with a few cups of water, and then I just set my catheter in there and let it sit there for a few minutes while I go do something else. And then basically I just take the catheter out. It's all clean, it's ready to use again. I keep it with my bag, so it's my catheter, and I just use it over and over again. And I've used catheters, probably 60 times, 80 times before they develop a little crack or something, and then you can tell that they're leaking. So I just use mine over and over again. If you want to change it every time, you can. When you get the setup with the ozone generator, the pediatric regulator, and the bags, we call it the ozone kit at our office, you're going to get 2 bags, so 2 people can do it. You're going to get also a bag of catheters, and that you'll be set for a long, long time. And then if you ever do need anything, like the hose that goes between the oxygen tank and the generator or anything like that, you can always call simply 03, or you can call our office and we can get that for you very easily. Those little components are very inexpensive. But yeah, that's rectal ozone. Very easy to do. And this video took way longer than it takes to actually do that at home. So even though it sounds kind of yucky, it's really not a bad thing at all. And it's a great way to get lots of ozone if you can't get into a functional medicine office and get intravenous ozone. And if you'd like more information, you can go to my website, www.nhicwestmi.com, go to the resources, and then click on ozone and read all about it. And we'll have a link below this video if you do want to order any of these things. That'll send you to Simply 03, and then you can purchase it through them. All right, take care. If you have any questions, please call our office, 616-301-0808. All right, take care. Have a great day. Bye-bye.